All right, let's dive right in. Today we're looking at a really fascinating and honestly kind of scary condition where your body's own defense system basically declares war on itself. We're talking about something called Guillain-Barre syndrome. So think about this for a second. What if the very system that's supposed to protect you, your immune system, what if it suddenly got its wires crossed and started attacking you, your own nerves? I mean, it sounds like something out of a sci-fi movie, right? But for someone with Guillain-Barre, this is very, very real.
For most people, the story starts out really subtly. Maybe a strange pins and needles feeling in your toes, or maybe you just feel a little unsteady on your feet. But then, over just a matter of hours or days, that weakness starts to climb. It literally creeps up your body. And you can imagine how confusing and absolutely terrifying that would be.
Okay, so let's get into Section 1, a sudden ascending weakness.
So when doctors are trying to figure this out, they're looking for a few classic clues. First off, the weakness is symmetrical. That means it's happening on both sides of your body at the same time as it moves up. Then there's the loss of reflexes. When the doctor taps your knee with that little hammer? Well, with GBS, nothing. The knee jerk just isn't there. And finally, people often describe this really weird feeling, this numbness or tingling that feels like they're wearing invisible gloves and socks. It's a very distinct pattern.
So what in the world is actually going on inside the body to cause all this chaos? Well, that brings us to Section 2, which we're calling your body's civil war.
Okay, so here's the textbook definition. It's an immune-mediated disorder where the immune system attacks your peripheral nerves. Now, what does that mean? Your peripheral nerves are basically all the nerves outside of your brain and spinal cord. And the best way to think about this is to imagine your nerves are like electrical wires. They have this protective coating called myelin, which is like the plastic insulation on a wire. Well, in GBS, your immune system comes along and starts stripping away that insulation. And when that happens, the signals get all messed up. They basically short circuit.
So the big question is, why? Why does this happen? What triggers this friendly fire from your own immune system? I mean, what makes your body turn on itself like this?
Well, it turns out that in most cases, we're talking about 60 to 70% of the time, the person had some kind of infection a few weeks before things went haywire. Usually it's a stomach bug, something caused by Campylobacter, or maybe a respiratory thing, like the flu. And the main theory for why this happens is just wild. It's called molecular mimicry. Basically, the germs from that infection look a lot like our own nerve cells. So your immune system goes on the attack to kill the germs, but then it gets confused. It sees your nerves, thinks they're the enemy too because they look so similar, and just keeps on attacking. It's a tragic case of mistaken identity.
And it's not always the exact same kind of attack either. GBS actually has a few different flavors. The most common one you see in places like the US and Europe is AIDP. That's the one we talked about, where the immune system strips the insulation off the nerve. But then there are other types, like AMN, where the attack goes straight for the wire itself, the axon. And then you have these really distinct variations like Miller-Fisher syndrome, or MFS. That one has this classic trio of symptoms: paralysis of the eye muscles, trouble with coordination, that's ataxia, and again, that loss of reflexes.
Okay, so you've got these symptoms. You might have had a recent infection. How do doctors actually nail down the diagnosis? That brings us to Section 3, the medical detective work.
The whole process is really like a piece of detective work. It always starts with a neurological exam, right? Doctors are checking for that ascending weakness and those missing reflexes. But then they move on to a couple of really key tests. There's the lumbar puncture, you probably know it as a spinal tap, where they take a tiny sample of the fluid around your spinal cord. And then they do these nerve conduction studies, which are pretty cool. It's literally like an electrician testing your body's wiring to see how well the electrical signals are getting through.
And while all of these tests are super important, it's often what they find in that spinal fluid that really cracks the case. There is a smoking gun, a telltale sign that doctors are looking for.
And here it is. This is the signature clue. In the spinal fluid, they find a really high level of protein. Think of that protein as the debris, the wreckage left over from the attack on the nerves. But, and this is the key part, the number of white blood cells, the immune system soldiers, is normal. This strange combination of high protein but normal cells is the classic calling card for GBS. Medically, it's called albumonocytologic dissociation, but all you need to know is that it's the telltale sign.
All right, so the diagnosis is in. Now it's a race against time to stop the attack. That's our next section, halting the attack.
So how do you stop the body from attacking itself? Well, there are two main ways to do it,
and they both work really well. The first one is called plasma exchange. It's basically like giving your blood an oil change. They take your blood out, filter out all those bad attack dog antibodies, and then put the clean blood back in. The other option is IVIG. With this one, they infuse you with a ton of donated healthy antibodies. These good guys basically flood the system and get in the way, preventing the bad antibodies from doing any more damage. IVIG is usually a bit simpler to do, so it gets used a lot.
Now here's a really important point, and it might surprise you. You might think, okay, overactive immune system, just hit it with steroids, right? That's usually the go-to. But in GBS, it just doesn't work. For reasons we don't fully understand, steroids have been shown to be completely ineffective. So that's a huge thing for doctors to remember. No steroids for Guillain-Barre.
So, the attack has been stopped, but the damage is done. Now comes the longest and, in many ways, the hardest part of the journey. Let's talk about Section 5, the path to recovery.
The illness itself has a pretty predictable pattern. First, there's the progression phase, where things get worse. This can last for a week or up to 3 weeks. Then, things hit a plateau. The weakness stops getting worse, and everything just kind of stabilizes for a few weeks. And then, finally, the recovery begins. And this is the part that really takes time. We're talking about the body having to slowly, piece by piece, repair its own nerves. It can take months and sometimes even years. It's a true marathon.
But after all that, after talking about how scary and long this whole process is, there is one number, one statistic that tells the most important part of this whole story.
And that number is about hope. Because despite how severe this illness can be, the outlook is actually incredibly good. Take a look at this. The vast majority of people, between 80 and 85%, make a full or at least a nearly full recovery. It's just an amazing testament to how resilient the human body can be, its incredible power to heal itself. And a huge piece of that healing puzzle is physiotherapy. I mean, it is the absolute cornerstone of recovery. Right from day one in the ICU, it's about preventing other problems from cropping up. And then later, it's all about that hard work of rebuilding muscle, retraining your coordination, and just helping people get their lives and their independence back. It's just critical.
So what's the big takeaway here? What does a condition like Guillain-Barre really teach us? I think it's this incredible paradox. On one hand, it's a shocking reminder of just how fragile we are, how a tiny case of mistaken identity at the molecular level can completely shut down your body. But on the other hand, it's maybe one of the most powerful stories of resilience you'll ever hear. It shows us that even after this intense internal civil war, the body has this amazing capacity to heal and rebuild. It's really something to think about. Thanks for joining me for this explainer.